So next we have Oakland Physician Network Services, and Peggy Best is going to be telling you about implementation at their sites. Peggy holds a BSN from Northern Michigan University and an MSA from Central Michigan University with 25 years clinical experience in the emergency department and 10 years in care and case management nursing. She currently serves as the lead care manager at Oakland Physician Network Services while working as the care manager in 2 internal medicine practices. Utilizing her knowledge and experience, Peggy has been instrumental in the development and expansion of the RN care management program at OPNS. She has established a program that integrates care management services and specialty offices, Trinity St. Joseph Mercy Oakland ED, and numerous skilled nursing facilities in the area with the goal of providing seamless, comprehensive care management for the chronically ill. In addition to serving as a mentor and trainer for the new OPNS care managers, Peggy provides ongoing support to the entire care management team through monthly care manager workgroup meetings and individual office consultations in such areas as care management, billing, and workflow processes. Peggy also lends her dedication and expertise to other OPNS endeavors, including CPC Plus, Specialist Team-Based Care, the MCT2D CQI, and the Palliative Care Initiative.
Hi, everyone. It's nice to be here. Much, I think, of what I'm going to talk about today has already been mentioned, but I think it's worth mentioning again. The 2 offices here, these accelerated sites, again, it's a little bit different from the other presenters. These are small sole practitioner offices, and I serve as the embedded care manager for both of these offices. So I was pretty intimately involved with the startup of this project, and it seems like I am very, very involved with MCT2D all of the time. So I think this is probably the most important concept here, is teamwork. I mean, I think we all realize that none of us can do or be responsible for this project alone. And because these offices are a little bit smaller, we have fewer resources. So if I were to say what was the most important I think thing that we implemented or that we started work with, it was the concept of teamwork and involving everyone from the office manager to the receptionist to the medical assistant, physician, and care manager. So when we began this project, it was really the physicians who were involved and myself beginning to learn about this. We quickly realized, though, that we need to educate the entire team because everybody needs to know what these initiatives are, what we're going to be doing, and ultimately what our goals are. So I'm going to talk a little bit about this ordering process, kind of go back and forth with it, and then talk about the physician and care manager collaboration. But this education with the rest of the team, the care team, was particularly important when it came to the ordering process. And I think all of us who've been involved with this understand that there are a bazillion nuances, right, associated with ordering medications, with ordering the CGMs, things that we never knew before. So that was very, very important to get everybody really on board and to share all of our information. If I figured something new out, then I needed to share it with everybody else so that they knew, the next time we order something or next time we go down that path, they'll have a better understanding. When it came to the medications, we really utilized the MCT2D payer resources. That was kind of our beginning when it came to, the SGLT2s, and the other medications. So we started with that, but again, and I'll talk about this a little bit later, is the challenges and barriers is we know that there are carve-outs and we know that there might be copays and deductibles. Something that I think was frustrating to all of us is we knew what was going to be right and what was going to benefit the patient. The problem was, how do we get it and how do we get it to the patient? So, so with the medications, we utilize the payer resource information. And then for the CGMs, again, that was a huge learning process in terms of how do we order these? We know, or we have begun to know how invaluable the CGMs are but how do we go about doing this? And what we actually did to make it less cumbersome, we were kind of getting tired of saying, well, what do I do with this Medicare? What do I do with this again? Who do I call? Is we developed an algorithm for coverage, and it's up in the office manager's office and up at the desk. So if I'm not there, or if somebody else, on the team is not there and a CGM needs to be ordered, they take a look at Medicare. This is what we do. Commercial, this is what we do. Humana, this is what we do. So we've learned to be a little bit more efficient, and kind of create those workflow processes. So this piece was also very important. And it was a little bit different for me because, again, I'm the only care manager in the office and there's only one physician in each office. So this piece was essential. We kind of went through the initial training together, which was good. And something that I began to think of is we knew these strategies were out there, right, to deal with diabetes. This has now, though, become such a more focused effort with our diabetes population. And I think we have, through the trainings, we have all learned so much more in terms of how these interventions and strategies work. So collaboration really is something that I'm really proud of with these two offices, and that the physician and myself, we kind of are responsible together for patient identification. We all know that the physician, has a great deal of knowledge about a patient, but a care manager also has and maybe sometimes different knowledge. So together we identify patients that would be good candidates for the medications. What kind of medications? I believe every patient's a good candidate for the CGM, but again, we have to think about, can the patient obtain it? Can the patient afford it? Can the patient understand the use? Can they manage insertion? So there's a lot of things that we need to assess when it comes to patient identification. Again, with the CGM and also with the medications, is the patient wanting to use an injectable? Can they manage an injectable? Things like that. Patient education, we have found, was huge. And this, this was in terms of the time we felt it took to do a really good job. So, I'll talk about this on the last slide in lessons learned. We have now carved out scheduled specific time for patient education. So kind of looks like this. So we talk about a patient who is either a good candidate for a new medication or who's a good candidate for a CGM. The physician discusses that with the patient and then refers that patient to myself as a care manager. So then I take over from there and do the education in terms of both. This is the medication, this is what it's going to do, on and on and on, and then talk about the CGM. And again, that's my opportunity to assess readiness and to assess a patient's ability to manage what we think is going to be the best strategy. And I don't want to forget the diet portion too, so we know that we can't manage diabetes with just one of these strategies. So again, incorporating that diet into this, it takes time. So I am responsible for much of the patient education. Again, like I said, we have learned to schedule specific care management appointments for these patients so that we do have time to do a really good job and do the education explanation thoroughly. What's also important is the follow-up. And this has really been an exercise in my personal organization skills so that I remember who and document who I have seen, where are they at in the process, and when is going to be a good time to follow up. That follow-up is either face-to-face or it is by phone. What we have found also, especially with the CGMs, is the older, some older patients have difficulty with the insertion, so they will want to come back, for a second reinsertion. Also with the medication effectiveness, So we want to know if there's any side effects. Are they administering medications correctly? Are they comfortable with the administration? And then have they seen a decrease in their blood sugars? And then the CGM data. And I have to say, I'm probably with this whole initiative most excited about the devices. I sometimes think I'm a real geek when it comes to this because I just love it when we get a new patient, and I love explaining how the data can help them. So again, at the follow-up visit, I do some of the education in terms of report interpretation and the data the patient can realize. But at the follow-up visit, I try to talk even more in depth and review with the patient what their data looks like, because by then, a week or two, they have had time to do their data collection. So we go through what is available on their reader or on their phone, what their reports look like, how that translates into what factors are affecting their blood sugars. So I guess kind of to wrap this up, this takes a lot of time. You know, this focus it takes a lot of time, but I think it's all worth it, right? And in their offices, obviously it's been worth it. So some other things that we have changed in terms of our workflow processes is we, in both of our EMRs, which are two different EMRs, we have identified patients who are involved in this initiative and identified patients who have CGMs. So when the patient is registering, again, this is goes to perhaps a receptionist responsibility. That alert is already there. Patient has a CGM, download the data. So we do that even before the patient is roomed. So the physician has that data ready. We print it out and it's downloaded also in the EMR. What we found helpful, and I think MedNet One talked about this a little bit too, is that we have developed pretty strong relationships with the Dexcom and our Freestyle Libre reps. So they have helped us load those platforms into our EMRs so that those patients who have the apps on their phones, you know, we get real-time data, you know, and then we understand the process of uploading the information from a reader. So that has changed. So again, we know what patients are involved in the initiative. We know which ones have the CGMs. We upload that data right away before the patient is roomed and before the physician sees the patient. Physician billing, and I'm not sure if anybody else has run into this, it would be interesting to talk to people, is that we have begun to bill for the CGM setup and also for the review. What we have found though is a few glitches in the review. We have found that there are patients who are being charged copays for the physician reviews. Now, it's kind of our thought process that, you know, we want to keep these patients engaged. And many times if it's one more charge a patient receives, they may decide not to go forward with this. So that's something to be aware of. You know, the review is only a once a month, you know, so if you upload patient data more than once a month, you have to be careful, you know, about that. And then the review you have to be careful of. And decide what your office wants to do with that copay or deductible for a patient. So that was, I will say, kind of a little disappointing when patients are coming up to us with bills for this. So clearly these interventions work. We know they do. And we have seen very, very good results and very exciting changes in our patients' level of control with using 3 strategies, using 1 strategy, using 2, or a combination. So that is very clear, and we are really, really excited about this. Through the dedication to time, to really good, effective patient identification, education, I think people have a much better understanding, or many patients have a much better understanding of how to manage their diabetes. We have, like I said, seen across the board improved sugar control and much, much better outcomes. I think what is most gratifying is when patients say, and I think this was alluded to before too, is that, you know, especially with the CGMs, I had no idea that this does this to my blood sugar. You know, it's that's so rewarding. And then to see the patient make changes, and lifestyle changes based on that. And I do want to say the power of, again, time and education when it comes to a low carb diet. I worked extensively with a patient, again, really focused care management time. And what we did was simply low carb diet and exercise education. You know, she dropped her A1C by 2 points and had lost 22 pounds in 3 months. And that was so motivating to her. So that was really great and encouraging. So it was a ton of work, but what we're finding is to establish an efficient workflow process is really worth it because we're no longer fumbling. We feel like we can get what we need to get done in an efficient and a timely manner, right? So there's bumps in the road, but through this learning process, I think we have really become pretty efficient, effective, and timely. So of course, once you establish kind of a solid workflow process, it's much easier to train new team members when they come on board too. So we're pretty happy with what we've done in terms of that. Well, some of the frustrations and lessons learned, and there's always lessons learned, and there's always something new around the corner. But again, there was a lot of time spent on learning our education trainings, but then also learning all about Dexcom, all about the Freestyle Libre, how to insert, learning how to, again, navigate the whole ordering process. What needs prior auth, what doesn't? Is this DME? Is this not a DME? So that seemed to take a huge chunk of time. Again, what we've done is developed a really strong relationship with the DME company. It was very, very helpful. And we continue to work with the reps, with the CGMs, and I'm calling them all the time. You know, can you get me samples, or can you help me troubleshoot this, and whatnot? Yeah, so begin to create those relationships. And again, success always comes back to that team effort, right? To everybody being involved, everybody shares that success. My advice would be, again, to dedicate time training and educating the entire care team, you know, really try to zero in and developing efficient workflow processes. And I think that's it. I think that I covered everything. Thank you.